Open enrollment season is here, and I'm so glad that you can be back with us. We are going to talk about State Health Benefit Plan today. I'm Winston Buckley, Director of Communications and Outreach for the Teachers Retirement System of Georgia, and welcome back to TRS Talks. So these sessions are here and designed to help you make better decisions and informed decisions around open enrollment. We know that your retirement planning is not just a TRS benefit, so that's why we're here to talk about your health insurance and the state health benefit plan. Now, we won't be answering any questions today in the chat. We will be reviewing those and answering some at a later time, but this is a live session, so we're going to pay attention to our host, and he is going to deliver a lot of information. And speaking about our guest, today we have with us Mr. Lewis Amos, the Executive Director for the State Health Benefit Plan of Georgia, or the State Health Benefit SHBP for short. In this role, he is responsible for managing the state health benefit plan that has over 670,000 members with a $3.8 billion annual spend. He is a nationally recognized speaker on the development and implementation of on-site wellness and health and wellness centers, and it has helped public sector entities on benefit and wellness plan designs. He is a dedicated public servant and is, again, dedicated to helping people live their best lives. So, Mr. Amos, thank you again for joining us, and we're so grateful for you being with us today.
Yeah, thank you so much to the Teachers Retirement System of Georgia. And on behalf of the Department of Community Health Commissioner, Dr. Deanberg, the DCH leadership, and the SHBP staff, we wanted to say thank you, as always, to those who are still actively teaching, and obviously to the retirees in terms of what you mean and what you've meant to this great state.
All right, Mr. Amos, you ready?
Yes, do.
All right, let's do it. Okay, so let's start with some of the initiatives and campaigns that SHBP has going on. So is there anything new that you all have launched this year?
Yes, as we go forward in our attempts to improve the overall quality of life, there are a couple of things that initiatives that we've started. One, as you know, chronic conditions, diabetes, hypertension, obesity are leading causes of healthcare costs, and in terms of impacting people's overall quality of life. We've launched a program, a pilot program called Hello Heart. And Hello Heart is a hypertension pilot, and it is focusing in on participants with hypertension. It's basically in a 90-county area, mostly rural. And the goal of this program is to help people to manage their hypertension. They'll receive a blood pressure cuff. They'll also receive scales, weight scales, and then they have the ability to talk to a coach and a counselor to help them in terms of managing that. Because as we all know, hypertension can lead to stroke, aneurysm, and other things that are related to hypertension. Secondly, another project that we're doing is Verta Health, and it's a diabetes reversal program. This is a unique program in that it's going to be targeting well over 6,000 participants, and it's first come, first serve. But they work with people who are diagnosed with diabetes. And we've seen in other states where people have lost 100, 200 pounds with this program. It's a very intense program. And the goal is obviously to reverse the impact of diabetes. It's to get people off of some of the medications that they're under. So those are some of the two big projects that we're doing. We're also looking to do a pilot project with dealing with sickle cell. So that is probably going to come up during the first quarter of 2026.
Oh, excellent. All right. So that's some great resources. Are there other resources that you want your members and our members to know about?
Yeah, as always. I mean, we're continuing with Be Well program for those members who are with Anthem and United. They have an opportunity to basically earn a $150 gift card or 480 points that will go towards both medical and pharmacy. In addition to that program, United Healthcare, those who are in the United Healthcare HMO program and the high deductible program, the subscriber and the spouse are eligible for an additional $250. For those, and these are all active members. For those who are with Kaiser, the subscriber and the spouse are eligible once they complete the program to earn up to $500 each. So, and that's a significant amount of money. And it's just going through the regular process as it relates to the Be Well annual exams, the on-site screenings, and then going through some coaching and counseling session. But as you can see, that's a significant amount of money that's available. Also, copay waiver program. And these programs are specifically for people who've been diagnosed with diabetes, asthma, and coronary heart disease. If they participate in these copay waiver programs, the copays are waived. And as you can imagine, folks who are diabetic, the cost for medication can be extremely expensive. But if they participate in these programs, basically they have an opportunity to have those copays waived.
Oh man, that's excellent.
Yeah.
Wow. So I hope people are taking advantage of that. I can tell you that I use that $500 gift card from Kaiser Stay Health Benefit Plan at the end of the year, and it comes right on time for Christmas. So yeah, I really like that program. So I'm an active member, and we'll start with some active member questions. All right. So open enrollment is starts this month through the middle of November, and it's important for members to enroll or update their coverage. But what happens if somebody has coverage and they do nothing during open enrollment?
Great question. So this open enrollment period is actually a passive enrollment. So what that basically means is that if you don't make any changes in terms of your benefit selections, what you currently have in 2025 will automatically roll over in 2026. So you'll have the same plan options, same plan designs if you don't take any activity in terms of making decisions.
Okay. All right. Well, that gives some comfort for somebody that for whatever reason may not get to it. All right. Now, I know there's some people who don't have the health insurance for whatever reason.
Mm-hmm.
Some people may feel like it's not worth it. So what would you say to an individual that says, oh, it's not worth it for me to carry health insurance?
It clearly in today's times and what we're facing, healthcare is probably one of the most critical decisions that people really need to take full advantage of. We have one of the best benefit programs that's offered in the public and private sector. And we're all one incident away from being in a financial catastrophe in terms of healthcare. Hospitalization for a 3 or 4 day period, we've seen now that could run anywhere from $150,000 to $200,000, if not more, depending on what you're being hospitalized for. And financially, I don't know how many people have the ability to pay that kind of funds. So it makes, we often say to the retirees, the two most important things for them is a pension check and healthcare insurance. But I think that carries over to the active as well. Mm-hmm. I mean, obviously, your salary, but healthcare is another important factor. And I would tell anybody, you need to make sure that you have healthcare coverage, even if it's catastrophic coverage. Being here, especially in Georgia, in terms of auto accidents and just everything that's that's come into play, I wouldn't recommend anybody to be without healthcare.
Yeah, I totally agree. And I remember being a younger man and thinking that it wasn't, the best thing to carry the health insurance because of the cost, and making some decisions to not go seek medical attention when I probably should have, because I didn't have the coverage. So yeah, you're right. Just one incident away from financial disaster or worse. So I totally agree with you.
Yeah. The other thing about it is what you're starting to see now is that conditions that typically would come upon someone when they get into the latter years, the 30s or 40s, we're now seeing like diabetes, hypertension. We're starting to see that it's starting impacting cancer, people at a earlier age. So it's just extremely critical.
Absolutely. I agree. Okay. All right. So we are rounding out 2025, going into 2026, and those decisions that we make now for next year. So any changes that we should expect in 2026?
Yeah, on the active side, basically, if participants who are in the high deductible health plan, they can now do a pre-tax deduction for the health savings account plan. So that's a little bit different. For active P65 participants, there is one change in terms of the pharmacy copays. We have made a reduction in the pharmacy copays for generic drugs. So under the Anthem and United plans, the generic copays for the HRA plans were 15%, $20 up to $50. So the copays for generics is now going down to $5. So that's a significant amount for those who are under these plans. So we see that, and the same thing will apply to the HMO plans. If you got the Anthem HMO, the United Healthcare HMO, the copays for generics will be $5. So if you're paying $20 for a generic copay, it's now going down to $5. And for people who are on, you have chronic conditions like diabetes, you may be under 3 or 4 different medications. And 3 medications would run on an average about $60 a month. That's now going down to $15. So that's a significant difference. The other thing is that the brand drugs, there's a $5 increase on those. But the goal here is just to make sure that you have accessibility to the medications, and that from a financial standpoint, you still have that choice to either do the brand or the non-preferred. But the generic drugs, we hope to increase those utilizations.
Oh, yeah, that's really good.
Yep.
Okay. All right. So considering the drug choices and the changes with the pharmacy and that sort of thing, what are all of the things that people should look at as far as like making the best plan decision? So, to take into account what you just said and the different options, how should somebody approach selecting the best plan for them and their family?
Well, clearly, I think there are a couple, from a financial decision, you have to make a decision of what's in your best interest. If you are in a scenario where you have serious medical conditions, you need to make sure that the copays and the deductibles will allow you to be able to access the best quality of care, but also from a financial standpoint, be able to cover it from the family perspective. The other thing is just making sure that you have care, you have coverage, and that coverage is something, even if it's just doing preventive services, you have the ability to, be seen, go through your screenings and doing those things. Those are important factors, I think, when you look at having coverage and what's the best coverage for you.
Okay. All right. Are there any like tools on the website that people can use to help them navigate that process, make it a little simple?
Sure.
For them?
The enrollment portal, myshbpga.adp.com, is available 24 hours a day, 7 days a week. There's also a 1-800 telephonic support line, customer service line, 1-800-610-1863. And during the open enrollment period, that's October 20th to November 7th, they'll be open on Monday through Fridays from 8:30 to 7:30. And then there will be some Saturday hours on the 2 Saturdays during that period. Basically, you have the ability to go through the enrollment portal. It does benefit comparisons. It talks about rates. It talks about the impact in terms of if I'm going to add someone to my plan, and everything you need to know is available through that portal or either through the customer service.
Okay. All right. So a lot of different ways to figure out what's the best plan for me and my family. Okay. All right. Now you've been doing this for a while, seen a lot of things, talked to a lot of members and retirees. So what would you say would be like the most common mistake or mistakes that people make during open enrollment period, if there are any?
Well, I think it's not taking an opportunity to look at what's being offered. It's kind of ironic that people will basically take healthcare. Well, I got coverage, and it's not till you need it. and it's getting into those cases when you really need it, and there's some financial impacts in terms of the decision that you've made. I think that's the most thing. I mean, it's open enrollment. Everybody's talking about, well, what do you have? Well, I'm just going to just continue with whatever I had the previous year, and things change.
Mhm.
And the fact of the matter is, I think people just need to take a more active role in the healthcare decision-making process. And that's the most important thing. It's just, it's important. It's just extremely important. And that's the one thing I think is just not just doing open enrollment, but, taking ownership.
Right.
And that to me, that's very critical.
Yes, absolutely. I couldn't have said that better. And I just want to double click on that point with the open enrollment, with your health insurance, with your TRS benefit, with all of your benefits, just taking a look at that each year or every 6 months with you and your family. All right. So that being said, are there any events? I know we're going to be bouncing around at some of them, but any events that y'all are putting on for people during open enrollment?
As in and all of doing both the open enrollment and retiree option change period, we're having both virtual meetings, and then there will be meetings that will be face-to-face meetings. There are approximately 16 benefit fairs. That's for the active and the pre-65 participants, and then the retiree option change period for the retirees. There are approximately 15 meetings that are held throughout the state. So these meetings will be held, throughout the state, and obviously it gives you a chance to visit with the carriers. The carriers are participating, but it also gives you an opportunity if you have some specific questions, you have specific concerns, that you can obtain information to be able to, help you in terms of making decisions if there are some questions.
Oh yeah. All right. That's good. So a lot of great information. I hope that you're finding this beneficial. So make sure that you have liked and subscribed if you haven't already, and share this out with your family and friends that will be impacted by any of this information that you're hearing today. All right. So let's shift a little bit to our retirees and talk specifically about them. All right. So last year was an important year for our retirees with that special option period. So any significant updates that they should be concerned or taking a look at this year?
Well, unfortunately, this year it's a little bit different. As many of you know, last year we had just completed a procurement, and we basically had to default the participants into the lowest cost plan. And then obviously everybody had an opportunity during the retiree option change period, open enrollment, to either stay with that plan or make the decision to go with another plan. So fortunately for this year, it is a passive enrollment. So if the retirees who are in the Medicare Advantage plans don't want to make a change, basically the same thing will happen. Then they will be rolled over to the same benefit plan options that they currently have. There is, obviously both on the active retirees and the Medicare Advantage retirees, there are some changes as it relates to the premiums, but from a plan decision perspective, if you don't want to make any changes, basically what you have offered will be offered in 2026. The same process will be in place after the open enrollment period ends in the December time period. You will get a confirmation of coverage statement that will confirm the selection for the upcoming plan year.
All right. Okay. All right. So that's good for the people that have been retired for a while. As y'all, I'm sure, are pretty aware, we process about 7,000 retirements in the summer, send a lot of stuff y'all way as a result of that. For those people that this is their first, I guess, I don't know if you call it open enrollment period for retirees. They're used to doing it as an active. Anything that's different that they should look out for as opposed to when they were active employees?
Yes, clearly. I think one of the things is obviously is making sure, for example, those who are participants under the teacher retirement system, is that you coordinate and making sure if you're getting a monthly annuity check or benefit check, that the benefits will be deducted out of that particular payment, rather than if you're an active employee, it comes, through the payroll location. So that's one of the probably most critical thing. Obviously when we get into those who are Medicare eligible and have to go to the Medicare Advantage plans, those requirements in terms of making sure at 65 that you go to Social Security and enroll in the Medicare Part V, and then to send a copy of that card to SHBP so we can get you enrolled correctly. We've done a better job of this in terms of folks who are in that category that are turning 65 and having to go to Medicare Advantage. There are calls that are going out 90, 60, and 30 days prior to that birthday. And it is, you have to take action if you want to continue coverage. And that's probably one of the biggest difference that you see is just making sure that people contact the payroll location and notify them, obviously, if you're getting ready to retire, and then coordinate through the teacher's retirement system to set up your monthly pension check. So it's critical that you do it because obviously you want the continuation of coverage in the retiree status.
Absolutely. So if you didn't pay attention to anything around this whole video, make sure that you rewind and watch this part. Even if you're a little ways from 65, I'm sure you know somebody, but just marking that on your calendars to contact the various departments. We will have somebody that's going to be talking about Social Security pretty soon. So that's ties into this part of the conversation. So thank you for sharing that. All right. You mentioned some of the prescription drug changes or the copays and the costs around that a little earlier. Does that apply to the retirees as well? Or is it a little different for them?
Yeah, it will apply to those retirees that are in the commercial plan pre-65. The Medicare Advantage retirees, there are no changes in terms of their pharmacy benefit for 2026. I do want to point out that, one of the things that went into effect this year in 2025 was that $2,000 maximum out of pocket. And as you can imagine, that has been a lifesaver for some folks who are on some very high cost medications. So in fact, you could reach that maximum during the first quarter of the year. And then for the remainder of the year, your pharmacy copay is zero. Mm-hmm. So, and it's given the cost of some of these high cost drugs, and it's easy, 1 or 2 months, you'll be able to reach that $2,000 out of pocket max. And that's a significant game changer because, obviously when you have multiple comorbidities, diabetes, hypertension, obesity, and other issues, you're on various different drugs. And when you're in that particular category, that $2,000 max is a lot easier to meet, quicker than if you're not in those particular scenarios.
Oh yeah, absolutely. Okay. All right. As far as changes, let's say something does change with a retiree. Are there any changes that are allowed outside of open enrollment period? Anything that would cause or require a change?
Only changes it still will be allowed if there's what's called a life event, and that's a marriage, divorce, adoption, something of that nature. So it has to occur. And if one of those events occurs, there's that 31-day period that you will need to make sure that you notify SHBP of that change so that obviously, we can make the correct changes to your plan enrollment. So basically it's through what's called a life-changing event, but outside of that, there is no additional changes that can be made.
Gotcha. Okay. All right. That's good to know. All right. You mentioned a number of resources earlier. Anything specific for retirees that they should pay attention to as opposed to active?
Yeah, the same thing applies to them. The enrollment portal, the myshbp ga.adp.com is available to them. The customer service is available as well. I think the other thing is that the vendors, especially those who are in the Medicare Advantage plans, they have an opportunity to contact United and Anthem if there are questions, if there's a need for assistance. So they are readily available to also assist. And that's the same thing on the commercial and on the pre-Medicare participants. The vendors are available for Kaiser, for those who are in the Kaiser service area. They all have customer service and they all are available to assist if there's a need to have assistance in terms of the benefit designs or questions about co-payments or anything, what's covered, what's not covered, anything of that nature.
Okay. All right. All right. Now we deal with this a lot with financial service companies, other outfits, sometimes masquerading as TRS or providing information where it's a little confusing to our members, and they might reach out to us and say, did y'all send us this? So how does Stay Health Benefit Plan communicate to retirees or active members?
It's interesting that you mentioned that, because we're coming upon, especially in the Medicare Advantage space, the Medicare open enrollment is slated for October 17th through December 7th. That's for folks at Medicare Advantage who can make changes. For us, I think the most critical piece of information that we could tell our participants is that do not enroll in any of these plans. I often mention that even in meetings, I say Joe Namath, Joe Montana, William Shatner, Magic Johnson, and all of these folks are out pitching the Medicare Advantage plans. And for our participants, you've worked 30, 40 years to have a benefit. And then to turn around and to enroll in one of these plans, and you will lose your SHB coverage for the remainder of your lifetime. It's not, those plans aren't, they may appear to be better. They'll call you and they'll bug you to the point that you almost want to lose your mind. But please, ma'am, please, sir, hang the phone up. You have one of the best coverages that's available. And if anything, that's probably the most critical decision that we face. We've done a great job. We've worked with our vendor partners in making sure that they educate folks. But, mail is going to come. You're going to be community centers, churches, in and about, and you'll be inundated from morning to night with people saying, hey, come join. And it may seem like it's something that's beneficial, but it's not. It's just not a good thing.
Mm-hmm. Absolutely. All right. Stay Health is about as best as you can get.
Yeah, exactly.
All right. Absolutely. Okay. Now, as people, retirees or actives are making their decisions, how can they get loved ones or their spouses or dependents involved in the process with them? Is that like a conversation? Like what are some suggestions that you can make?
Well, I think it's critical. One is just conversations. Also, the retiree option meetings that are available throughout the state. We encourage you to bring, your significant other to those meetings. Also, calling customer service, the 1-800 number. They have the ability to answer questions and provide assistance. The enrollment portal has that same ability to provide assistance, and then obviously the carriers themselves. So there's a wide variety of resources that are available. And, one of the things we encourage people, if you have a question, is to ask. I mean, it's the resources are there to help. So, we just make them available and take full advantage of them.
Okay. All right. All right. So for our members that might be caring for elderly or disabled dependents, do we have resources? I'm sure you have resources that are available for them as well.
Yes, the same thing. Yeah, with them, I would just encourage to basically call the customer service line, and they can kind of talk people through. Because if there's a need to have power of attorney or anything of that nature in terms of the HIPAA violations and how to go through that process, they can provide the assistance that's needed. And that's that 1-800-610-1863. And they can really assist in those areas. Because, given, in terms of especially some of the retirees, and that, sometimes they move from different, siblings to another. And, there are people who are looking after them. The customer service team is able to help to assist in those decisions and to make sure. One of the things is we want to make sure that nobody loses coverage. Mm-hmm. That's the most important thing, is that nobody loses coverage, and that decisions are made on behalf of somebody that could potentially impact them losing coverage. So that's the one thing that we really want to focus on, is just make sure that people are covered, and that, if there are issues, that we try to resolve them as quickly as possible.
Gotcha. Okay. So that number, would that be say the same number that a loved one would reach out to
Yeah,
if
exactly.
somebody,
Yeah.
let's say they can't manage their own health care or
Right,
are
right,
unable to
right,
make decisions, that
right.
would be the
Yeah,
same.
yeah. And that's process protocols, obviously, from a HIPAA standpoint. And then administratively, I mean, there's some processes that people will need to follow, to make sure that they have the authority to speak on behalf of someone. So, you try to prevent any type of fraudulent activity. So that's one of the things that going through that customer service, they have processes, and even the carriers, they have processes. So people can't just automatically make decisions if they don't have the authority to make
Right.
those decisions.
Gotcha. Okay. All right. All right. Okay. So we just a few more questions
Okay,
here
great.
before, unless there's something that you're dying
No, I'm great.
to share that we haven't covered. All right. A lot of people are concerned about legislature and things that are happening. Anything that you might have seen on a legislative level, any regulatory changes that might affect the state health benefit plan?
On the current process, we don't see anything. I mean, obviously there are a lot of things going on a national level, but from the state health benefit perspective, I mean, we pretty much, if there are legislative changes, it will take place during the upcoming session. But we don't see anything as of right now. The one good thing about it is the benefits are offered. I mean, it's solid, and from a financial standpoint, the contracts are in place. So I wouldn't be as much of concern unless there are some significant changes on the national level. And obviously, if there are changes, we have the responsibility of communicating and making sure our participants are made aware of it in advance.
Okay. All right. That sounds great. Well, you've shared a lot of great information with us. This is being recorded, so you all can go back and listen to this. But any last piece of advice, any words of wisdom that you want to leave with our audience before we wrap this up?
Yeah, I just really want to emphasize one thing. I've had the opportunity to be a part of meetings with state health plans across the country. And one of the things obviously we're all are seeing is that the healthcare costs are increasing significantly. So Georgia is not any different than any state. I was recently at a meeting with southern states, and I mean, everybody is faced with the same thing in terms of rising healthcare costs. But more importantly, one of the things I think that stood out to me, when you compare what the state health benefit plan offers and what's being offered in the private sector and even on the public sector, it's still probably, in my opinion, one of the best health plan options that's available in the country. And that's one thing I think we can take pride in knowing that, you know, from the pension perspective and also from the healthcare perspective, it is probably equal to greater than what's offered, even on the public sector side, and even on the private sector side. So that's the one good thing about it. It's great benefits. I encourage people to take an active role in the healthcare decision making process. What that means is, get the annual screenings, and immunizations and whatever else is recommended, and take full advantage of the health care. I mean, there are people who have insurance, don't get annual physicals. I mean, that kind of stuff. I mean, it's being able to manage that process, because if there is issues or concerns, i.e. cancer or things of that nature, catching it early makes a more significant difference in your ability to survive and your ability to have a quality of life. But we're happy with the benefits that we're offered. We're committed to continuing to offer these benefits to our active employees as well as our retirees.
All right. Thank you. Thank you so much for sharing that. I know our audience, they appreciate that. And I just want to personally say thank you. My family has benefited a great deal from the coverage that we've had. So I can personally speak to how great of a job that you all are doing. And thank you for your leadership there at the State Health Benefit Plan. So I'm sure you're aware, but just know that you are doing great work.
We
really
and thanks to the teacher retirement system for the partnership that we've been able to develop, especially in the last 3 or 4 years, in terms of your ability to work with us and to get information out and to make sure we're taking care of our participants.
Yes, indeed. All right. All right. Well, that wraps up our session today with Mr. Amos, the Executive Director of the State Health Benefit Plan. So again, you can watch this at a later time. Make sure that you have liked and subscribed again and share this with your family and friends that would be helping you with these decisions. I'm sure you probably have some coworkers that weren't able to watch this during this time, but this is, again, very valuable information for them to watch as well. So our next event is going to be on October 17th. That's a Friday at 3:30 p.m. We will record that as well. But if you can catch us live, we will be with Danny Coffey, the wealthy teacher who is a motivational speaker and also talks about finances and caring for elderly on a teacher's budget. So hopefully you can join us. Then again, this is TRS Talks. I'm Winston Buckley, Director of Communications and Outreach, and we will hope to see you next time. Thank you.